there and welcome. It is so good to have you with me today. Thank you for making time to be with me. We're going to cover some really important questions today. We're going to look at a few eyes as well, but we really want to cover these top 5 questions that all iridologists should be able to answer. And this will serve as a really good basic introduction to the concept of constitutional iridology. I would love it if you would take just a moment and drop in the chat box what your background is with iridology. Are you new to it? Have you taken any formal training in it? Are you self-taught? Just let me know where you're at so that I can do a better job of delivering the kind of information that will meet your needs. We've got Channa here. She is learning iridology. She's just going to be starting dynamic iridology with me next week, and a few more. And she's watched a lot of the videos. Good job. Fantastic. So good to have you with me. We're going to buzz through a lot of the preamble stuff here. We've also got Lori, who's got formal training, and she's practicing as an iridologist. Fantastic. I am an IPA Level 3 certified iridologist and an IPA Level 3 certified iridology instructor. There are only 3 Level 3 IPA certified instructors in the world right now. I was one of the first 3, actually, which is kind of fun. And I'm also a certified nutrition coach and a master herbalist. Just want to drop a bug in your ear that the next live course is starting on November 1st, the next live version of Dynamic Iridology, and it is taught via webinar online. And so if you are looking for an iridology course, we maybe need to have a conversation. I'm just going to skip past that because I want to get right to the questions. So the questions we are going to ask today is, what is iridology? And this is an important thing for us to be able to answer, because many times our clients haven't got a clue what iridology is, and we need to be able to explain it in a way that makes sense to them. We need to know, why does it work? And we need to be able to explain that as well. What can it teach us? Why should professionals use constitutional iridology specifically? And how should constitutional iridology be used in clinical practice? These are really important questions for you as you're working with clients, to be able to answer their questions, but also to help you be more proficient and professional when you are practicing your iridology skill set. So what is constitutional iridology? Iridology, very simply, is, yes, Channa's got that right. It is the study of the iris. That's exactly what it is. And again, many of your clients may not even know what an iris is. When you say iris, they may think garden flower. So you need to explain that it is the colored part of the eyeball. And when we explain that, they go, oh yeah, okay, I knew that. So that's good. Now it's pronounced iridology, not iridology. It's an iris, not an iris. So it's iridology. Now, when we are looking at this, we're going to gather information. We also, as modern iridologists, study the sclera, which is the white part of the eye, right? And so as we look at this, we know that the sclera is very dynamic. And you know that. If you've ever had a really good hard cry, and then you've gone into the washroom to splash water on your face and to look at yourself in your mirror and see how puffy-eyed you are, you know that the whites of your eyes will get bloodshot very quickly when they're irritated. But you also know that that cool water and 5 minutes and they calm down. So the sclera is very, very dynamic. Now, so iridology is technically the study of the iris, but we now also include the study of the sclera because they give us different information. So why does this work? It works because the eyeball is the largest neural receptor of the body. It is a neural receptor that is connected directly to the brain via the optic nerve. Because of that, we know many things about the eye. So first off, the iris itself has 28,000 nerve endings. We know what a few of them do, but we don't know what most of them do. So there's a lot of research that needs to happen. We also know, and if you've looked at any pictures of developing embryos, you will know that the eyeball and the optic nerves form at the same time the brain is forming, because in truth, the eyeball and the optic nerve, being neural receptor and neurons, are extensions of the brain. And what that means is that if the brain knows something, the eye knows it too. So if the brain, if the nervous system is aware of some kind of a genetic anomaly, there will be some kind of an anomaly in the iris. Now, that's not one marking equals one problem, because sometimes we see different markings in the iris that spell a certain situation. We might have two sets of eyes, different markings, but we've got the same situation happening. And that's where it becomes important for us to understand that what we see in the irides is all about genetic potential, not a guarantee. So there'll usually be some kind of a marking in the iris itself if there is an anomaly in the genetics somewhere. All right, so what can iridology teach us? What can iridology teach us? So today we're going to focus on the iris. We're not going to do much with the sclera at all. And so the irides teach us about inherent predispositions. So when we look at this particular set of eyes, these irides teach us that this person is predisposed to spending a lot of time reacting in the sympathetic nervous system. So this person spends a lot of time in fight, flight, or freeze. Some kind of an event in her day that if you had the same thing happen, you'd go, yeah, whatever. She goes, oh my goodness, the sky is falling in, we're all gonna die. That's an exaggeration. But she does respond in the sympathetic system, which means she responds in a big way, often to things that are very small. So when we see something like this, and here we're looking at these rings going around and the lines that are radiating out here, these darker lines, that's what tells us she functions in the sympathetic nervous system. So we know that we need to use a nervine and probably an adaptogen if you know your herbs. So what would be a good example of a nervine or a good adaptogen to use for someone who is always on edge, always waiting for the next bomb to go off? What's your favorite adaptogen or nervine or adaptogenic nervine? Chamomile. Chamomile is a beautiful nervine. Good option there. Ashwagandha. Lori, good one. Can you imagine what would happen if you put chamomile with ashwagandha? No one says we can't do that, right? This person is also predisposed to having her liver run the show. So the liver does over 500 different jobs, over 500 that we know of. And so what that really means is we need to understand anatomy and physiology to understand the jobs the liver does in order to then correlate her symptoms to liver function. Does that make sense? Does that make sense that we need to have that understanding of how the body works if we're going to work with the body, right? So we know that liver has immune functions, that it has jobs in regulating blood sugars, that it does things with purifying the blood, with taking toxins out and neutralizing them. We know that the liver has roles with allergies and allergic responses, hormonal issues, digestion. It's an auxiliary organ for digestion. So when we see these eyes and we go, well, her liver wants to run the show, that's not enough information. What the eyes do then is they teach us what questions to ask. So let's find out why she came in. She came in because she was having recurring bladder infections and problems with allergies. And, she'd end up sinusy and her eyes would swell shut, and then she'd start breaking out in hives. So her eyes suggest an increased predisposition towards allergies and infections because her liver may not want to do all of its jobs properly. And so we want to work on a constitutional level here, not on a surface level. I'm not going to throw an antibiotic type of herb at her. I'm not necessarily even going to throw something at her for the bladder infections, because those are symptoms. They are the messengers. They're not the problem. And so, if I gave her maybe some golden seal and echinacea with some juniper in it or something like that, yeah, we could take care of the bladder infections or the UTIs, and we could maybe have an impact on the allergies, but we're really just mostly working on symptoms there. So we want to go deeper. Now, the golden seal, though, could be deeper because golden seal is a bitter herb, which means it not only has components that are going to help fight infection, but it works with the liver. And so that's probably where we want to go with her, is more liver support than anything else. Now, and that will likely help her to get rid of toxins from her liver that may be sitting in the blood, that may be actually irritating the kidneys, that may be then further irritating the bladder. So golden seal might be a way to work. Now, interestingly, she's been away from me for a few years, and she just connected with me last week. She was in a full-on panic because she was starting to break out in hives all over her body. And she waited till she was pretty much covered in hives before she called me. So she'd been breaking out for 3 or 4 days, and it was getting worse by the day. So in doing that, with waiting too long, really to get enough good herbs into her to backtrack that quickly wasn't going to happen for her. So I did suggest she should go to the urgent care facility. She ended up on prednisone for 4 days, and that has calmed things down. But if she had reached out to me at the very first sign of hives, instead of waiting till she was covered, we could have gotten to the bottom of it. There are many herbs and many approaches that will work on the liver to take down those histamine responses, and that will help to clear the histamines faster to prevent major episodes like what she had. We need to remember that constitutional iridology does not give us the ability to diagnose. It does not help us to give disease names. It teaches us what questions to ask. When we take the client's symptom and we pair it with what we see in the eyes, we now understand, and we put that with our anatomy and physiology understanding. We then understand what questions we need to ask, and we begin to understand the pathways we should be recommending for our client to improve their health. Now, you probably noticed I didn't say that this person's eyes look toxic. I did not say that her eyes say she needs to cleanse. I did not say she has a congested liver. I did say that her liver may need support. I did not say that these eyes look unhealthy. We can't possibly know that from looking at the eyes alone. We do need to have that conversation with our client. We need to understand their symptoms. We need to understand what she's already doing. Now, this client, before she had this most recent episode, as we were discussing all the supplements she was taking, she's taking a lot. She's got what I call a shotgun pattern, to the extent that I believe she may actually have caused some of the problem herself by overloading her body. You can't take too much of a good thing, right? And she may have done that. So let's do another one of these. What can iridology teach us? So this was a client in her late 30s, early 40s when she came to me, and her concern was seasonal allergies. So as we look at her iris, this is going to tell us what her genetic predispositions are, where her genetic strengths and weaknesses, maybe where she might need constant nurturing. Her sclera is going to give us more dynamic information, what's going on right now, right? So she has a very tight collarette. Amongst other things, that alone suggests that she is predisposed to constipation and to poor energy production. However, just because she's predisposed doesn't mean that's what she's experiencing. And so we never say to the client, oh, I bet you're constipated and you don't make energy very well, because she may have figured out a long time ago that when she eats a certain way or when she does certain things, she does get constipated and her energy gets really awful. But when she does these other things, she stays unconstipated, her bowel functions well, and her energy is great. So we always need to have that conversation to find out, where is she really starting from? Okay, so her problem again was seasonal allergies. She wasn't complaining of constipation. So this client was actually very much like that. She had been on a wellness journey for many, many years, and she was very diet aware. She ate small meals. She ate lots of vegetables, very little grain, and she was very selective about her proteins, but she was getting protein and she was getting an appropriate amount. She was making really good really good food choices overall. She had also already figured out for herself that digestive aids, and she had some different types of enzymes and betaine hydrochloric acid that she just always had available. And she knew when she would need to take which ones to optimize her digestion. She had sorted that out on her own. All I needed to do as far as her digestion was concerned was say, congratulations on a job well done. I believe you are completely on the right track and doing the right things for your digestion. Her eyes do suggest another predisposition, and this one is to allergies in particular, and allergies that show up on the mucous membranes very specifically. So she had said she wanted help with allergies, but she really didn't say seasonal allergies in the first sentence. So as I'm looking at her eyes, I asked her, how do your allergy symptoms show up? Do they show up in your sinuses? Uh-huh. And would you say they're more seasonal? She said, absolutely. Once we start to where the snow is completely melted, I can't sleep with my window open because the pollens and the dusts and the molds just do me in. So why would I come up with that conclusion? When I look right here, just outside the collarette, this tells me that she has a bit of a predisposition towards leaky gut. And that suggests then that she's going to have more problems with mucus on mucous membranes, and that is going to be the result largely of allergies and of leaky gut. So we started working on that. And what we did was we gave her some collagen along with having her use her really good hydrochloric acid so that we could begin rebuilding her intestinal lining. I love collagen for rebuilding the intestinal lining. And we got her to where she was fine year round. We rebuilt that lining and got it. And with the digestive support she was doing on her own on an ongoing basis, she never went back to having spring allergies again, which was really exciting. So what can iridology teach us? It teaches us where a person's genetic strengths and weaknesses are when we look at the iris. And the sclera teaches us where there may be hot spots right now. When we understand what we're looking at in the eyes, in the irides themselves particularly, and correlate that to their symptoms and to their diet and their lifestyle, it teaches us what recommendations we should be making. So first off, teaches us the questions to ask, and then it teaches us what recommendations we can make that will be beneficial for our client. So why should professionals use constitutional iridology? I really, really believe in constitutional iridology. I've practiced other styles of iridology, and I will tell you that over my 4+ decades in this profession, constitutional is the only way I would go for anything to do with physical health. The emotional iridologies are wonderful for that side of life, but we're talking about the physical stuff right now. So I think we should be using constitutional iridology because it helps us to assess our client holistically. As we look at their eyes and as we correlate that with their symptoms, we are able to start connecting body parts. We can see that the liver could have an impact on an allergy. We can see that the kidneys and the skin might not want to play nicely in the sandbox. We can see if the stomach doesn't want to digest properly, especially those proteins. And heaven knows that if you're not digesting protein, nothing else is going to work properly, right? And so constitutional helps us to assess our clients holistically. And that is brilliant. I mean, the very first thing that I do when I'm with a client and I'm doing their eyes is I look at the constitution. I will then look at their subtypes. I don't actually map anything in the first appointment. That's going deeper than I need to go. Constitutional helps us to see how to balance using cleansing and nourishing. How much cleansing do our clients need? How much nourishing do they need? And it's not because we're going to see the irides change. It's because we understand from what we see in their irides what the interplay is of the organs. And the irides help us to understand how to alter programs as warranted. The irides don't change based on diet or supplements or things like that. But as a client improves, we can look at that same set of eye photos. We can use a set of eye photos for up to a year before we reshoot, mostly for sclera, but also to see if more pigment has deposited in the eye. And we are using that one set of photos for that whole first year and we're assessing them. I'm not doing a very good job of this sentence right now. Let me backtrack that. We use that first set of eye photos or any set of eye photos repeatedly because as our client's health changes, as their symptoms change, we can assess the same set of markers in different ways, right? So the set of markers that we interpreted one way at the outset can have a different meaning later on in the process. There, that works better. Did that make sense? Let me know if that made sense. A little bit of stumbled brain there. It made sense? Fantastic. Shannon grabbed that. Wonderful. Wonderful. And when we do, and thank you, Peggy, for saying it made sense as well. So good. When we use constitutional iridology, it helps us to avoid slicing and dicing or subdividing the body into tiny parts, because it helps us to understand how body parts are connected. And that's in part because we have such a good foundation in anatomy and physiology. That means we're going to avoid giving a supplement for this and a supplement for that and a supplement for this and a supplement for that. We avoid the one supplement for one marking for one symptom problem. We're able to take that step back and say, you've got all these symptoms. And as we look at your eyes, this is how the symptoms are all connected. Here is the root of the problem. Let's work on this root and watch how the symptoms resolve themselves. And so in doing that, we are working with the person as a whole. We're not working with the person as a stomach that has reflux, or a kidney that has a stone, or a bladder that has a urinary tract infection, or a case of high blood pressure. We're using everything we see to help us understand this client well. I mean, you know that blood pressure can come from the adrenal glands and the kidneys, right? It's got at least two points of origin. And beyond that, the liver plays a huge role in it. So in order to deal with blood pressure, you've got to decide which of those things and or which order should they be addressed in, and the iridology will help you with that. To that end, I have developed, based on the work of Bill Cardona, the dynamic iridology map. Now, Bill Cardona was my original constitutional teacher, And I'm still in touch with him. I actually just exchanged emails with him last week. I had another question. I had hoped that after this many years as an iridologist, I would know everything, but I don't quite. And so when I come up with a question, I reach out to my mentor. And while he's no longer teaching, he is still happy to help. And I appreciate that so much. He developed the essential map of iridology about 30 years ago. And since then, there's been more research. And that research has done things like it has added the heart in more locations than what we started with the Bernard Jensen map. It has added the pancreas in more locations than what we knew about 40 years ago. And so we just updated Bill's map with his and renamed it with his permission. You'll see that on this map, we actually don't cover things like the earlobe and the pinky finger and the foot, because they don't, as a general rule, affect the metabolism of the entire body. We are interested in organs that have a metabolic impact. And as we understand that metabolic impact, we can go so much deeper in our work. And we don't get bogged down in details like, when did you hurt your shoulder? Which is probably not affecting how the liver functions, right? So we don't get bogged down in those details unless it's absolutely necessary and the client needs an answer to that. So how should iridology be used in clinical practice? It should be used to help us understand our client and our client's needs better and more quickly. And it should not be used to overload our client with information they don't need to get well. These are the eyes of a client. Shanna, I love that it should be used as an assessment tool. So good, so very good. This is a client of mine. She came to me apparently when she was in her 30s, and I helped her with a sinus problem and did such a good job that I only saw her twice and she never needed to come back. When she was in her mid 50s, she was now having hot flashes, and she remembered the good work that we had done, and she wanted to know if I could help her now, because with these hot flashes, she had been doing hormone replacement therapy, which was not her happy place. She did not want to be doing that. So she wanted to know, what could we do? As we looked at her eyes, again, her eyes tell me that she functions in the sympathetic nervous system. And they tell me also that her adrenal glands are likely genetically inherently to want to be out of balance. And so all of this is going to have a huge impact when you understand menopause. It's going to have a huge impact on how she does menopause. Her eye type with this pigment also tells me that her liver could be a key player here. So I needed to ask her a bunch of questions on the nervous system, adrenal glands. I wanted to know, how does she handle stress? She's a psychologist. She's got lots of tools at her fingertips, and she's really learned that a key part of balancing her stress and managing her stress was to, number one, monitor her caseload every day and vary the number of patients she would work with in a day based on what she knew their demands to be. She also knew that her diet was important, and she knew that daily physical activity and meditation were key for helping her manage stress. Love it. I love it when my clients come in and they're so self-aware. I asked her, do your hot flashes get worse when you are stressed? And she said, absolutely yes. Brilliant, good information. Then we went to the liver questions. Was she aware of any problems she had digesting fats? She was not aware of any. Now that's important, because not just fats, but the fats give me an indication of how is she going to handle dietary fats and how is that going to affect how she makes her hormones. I asked her if she had any issues with holding a grudge or with anger, holding on to anger. And she said she used to, but being a psychologist has been very helpful because she's done a lot of work for herself to get to where she can release that kind of energy very quickly and very easily. So as we looked at her diet, Her diet was really quite good. I often will tease my clients when they've got a really good diet, and I'll say, can I come live with you? I like the way you eat, right? And so her diet was good except for one thing. And that one thing that she has one cup of Turkish coffee every day. I know nothing about coffee. It's not a part of my life, but I understand it's a fairly strong coffee and it's a very small cup. And so I asked her, could you do an experiment and not drink the Turkish coffee for 10 days? And she said, absolutely, I can do that. Now, why would I ask her to give up coffee? What do you think I was looking for? What impact would coffee have on any of her situations? It depletes B vitamins. It absolutely does. It absolutely does. What else does coffee do? It sucks calcium and magnesium. Chan has been studying. Love this. Love this. What else does coffee do? Reduce stimulants that might contribute to anxiety. Yeah, it stresses the adrenals. Absolutely pointing in the right direction there, Lori and Peggy. Yep. It increases acidity. Yes. Yes. Has anyone seen anything on this list of what coffee does that would be good for us? Not I, said the little red hen, right? Absolutely. Chen is laughing. Yeah, like coffee would be good for us. So, again, caffeine stresses the adrenals. It depletes the B vitamins. It sucks out our calcium and magnesium. And so, after she'd been off this for 10 days, we got her back in for an appointment. And I asked, how did it go? And she said, it went fine. And I said, what did you notice for being off the coffee? And she said, my hot flashes were almost gone. And I said, that is really good information. I said, how do you want to proceed from here? What is your decision? Will you continue to drink coffee on a daily basis, or are you going to cut it back to Sunday morning brunch, or drop it altogether? And her response actually broke my heart because she said, I like coffee. This is the only thing I do. I don't even drink alcohol. I don't consume refined flour. I don't consume refined sugars. This is the only thing I do, and I'm not going to give it up. It broke my heart. Such a simple solution, not willing to look for something to replace that coffee. And so I had to literally give her a hug and say, there's nothing I can do to outsmart that coffee. I have nothing that is stronger than that coffee. And so I don't think I can offer you anything. B vitamins will help your body, but they're not going to stop the hot flashes. As would calcium and magnesium be good for you. So you might want to do those as well, but there's nothing I can do that will stop the hot flashes if you want to be drinking coffee. And we actually did try some other things and they just didn't work. So she's got a lot of other markers in her eyes that suggest liver insufficiencies, that suggest challenges in managing her carbohydrates and balancing her blood lipids. She's got markers that suggest congestion and insufficiency in the digestive zones, increased risks for digestion. She's got some things that suggest spinal subluxations as well. But these were issues for another appointment. They weren't about addressing what she came in for. So iridology, when we use it in clinical practice, should help us laser in on the thing that our client has asked for help with. Once we have got them good results in that area, then we can use the iridology to help us branch out and work on other things, other levels, other symptoms, other risk factors that the client has not expressed concerns about. So I think iridology should be used to help us laser in on what needs to be addressed to help our client get results with the thing they've asked for. Too often I see iridologists giving long lists of markers and then long lists of remedies. I used to do that. And I will tell you, it's a quick recipe for failure because that long list of markers may or may not be relevant to my client's situation right now. That long list of things they could do is overwhelming. They don't know where to start. They don't know how important one is over another. They don't know how to rank these. So they often will pick the thing that they can do that's the easiest, and often has the least impact. So they do that and they go, well, that didn't really work. That iridologist doesn't know what she's doing. I don't think I'll ever go back. Right? Where when we focus on just a couple of markers that flesh out the story of why the client has the symptom, and when we choose a couple of very key, very specific things they can work on, they see results. I love what Peggy says in the comments, and they wouldn't stick with it. No, they won't. They don't. They can't. It's too much of a life change. We want to do those changes gradually. These are the photos from one client. He was in his, this was 2014 when we did the top photos. The bottom ones were last year, 2022. He was 64 when we did these new photos, different cameras, different lighting setups, right? This one would have been an 8 megapixel digital with an incandescent ring flash. This was a 24 megapixel digital with LED flashes. So he came to me back here in 2014, and we're not going to use this as a before and after experiment, but he came to me in 2014. We gave him some ideas, worked on his problems, but he didn't stick with it. Then in 2022, he came in a bit of a panic. He'd now received the diagnosis of being pre-diabetic. His sugars were averaging 7 to 7.5. The doctor had prescribed metformin, and that gave him diarrhea. So they switched him to Glumetza, and he has elevated blood pressure. He's on hydrochlorothiazide as a diuretic, and that messed up his potassium. So now his potassium was too low. He's on Trandolapril, which is a myelin torvastatin, which is one of the statin drugs for cholesterol. And of course, when you're on a blood pressure med with a man his age, it usually results in erectile dysfunction. And so he was also on Viagra. So we've got all of these different meds going in, and he's not liking this one little bit. His glomerular filtration was a very low normal, which suggests easing towards early kidney disease. His hemoglobin A1C was 7.2. It should be below 5.7. And he had been on the cholesterol meds long enough that his cholesterol was starting to come down. The elevated hemoglobin A1C indicates insulin resistance. And that is usually the result of diet and lifestyle. So Peggy's asking, was he jaundiced? He was not at this point in time. So when we do an assessment here, we're going to use the photos on the bottom because those are the newer photos. His eyes show us he tends towards elevated systemic acid. Could that possibly be stressing his kidneys and also reducing his glomerular filtration rate, which would increase his acid levels in his tissue, which would lead to inflammation? We know that type 2 diabetes is an inflammatory process. So could that increase his risk of insulin resistance? And we also know when the kidneys are unhappy, that can increase the endothelin, which is a vasoconstrictor, and the aldosterone, which increases sodium and reduces potassium. So that lets the potassium fall. Oh my goodness, this is why we need anatomy and physiology. We need to know how all these organs are connected. We also see in his nutritive zone that his stomach tends to be under acid. I'll talk about that more and talk about stomach or gastric reflux in a moment. So initially, we recommended he eat more vegetables, including some fermented vegetables. and that he add protein at breakfast time. I also suggested that he eliminate the coffee. Now, on those vegetables, I encouraged him to go with a lot of leafy greens. So we've only done a couple of things, more vegetables, and gave him some guidelines for what should be in that, and eliminate the coffee and increase protein at breakfast, right? Because breakfast until now was typically a bagel and coffee, not the breakfast of champions. And then I suggested that he needed to get some exercise. And I didn't need it to be an hour at the gym every day, but it needed to include some resistance training. Stretchy bands work great because we wanted him to burn fat and build muscle. And we know that daily exercise also helps to reduce insulin resistance. So we're working from several angles. I recommended some L-arginine for him and some berberine for him as well. After 3 months, his hemoglobin A1C was consistently down to 5.9 from over 7. His doctor at that point said, if you keep this up, we'll check your blood again in 6 months. If you keep this up, we'll be taking you off the Glumetza and or the Jardiance. You'll be coming off some blood sugar medications. Fantastic. But I noticed in that appointment that he was constantly clearing his throat. That is an indication of either postnasal drip or of acid reflux. And so he clearly didn't have sinus congestion. So I assumed acid reflux. And acid is the wrong word for it. What we're saying is something is backwashing up the esophagus. It does not need to be acid. It could be more alkaline, but it's backwashing because that lower esophageal sphincter doesn't close properly. And the lower esophageal sphincter won't close if the stomach has too little acid. So we tweaked his program. We added some of the Nature's Sunshine protein digestivate, the betaine hydrochloric acid. We added garden essence enzymes, and we kept him on the berberine and the L-arginine. I suggested that he should get assessed by an osteopath or a chiropractor to check him for a locked diaphragm, which is another way of describing what a doctor would call a hiatal hernia. And I don't know if he ever did that. We seem to get good control of his symptoms because he was having a little bit of that refluxy kind of burny pain. But with these added digestive aids, that calms down. And after 6 months, his doctor took off both the hydrochlorothiazide, so that's the diuretic, and the Glumetza. So took him off 2 of his medications, and he's on his way to having all 5. He was on 5 meds when he came in. He's on his way to getting them all reduced and eliminated, which is absolutely brilliant. So how do we use iridology? We use it to guide our questions, to help us create rapport with our clients, because the eyes will guide us to ask questions that are relevant to that client instead of a generic, broad shotgun pattern of questions that are mostly not relevant. And we use the eyes to help inform the recommendations we are going to make. One more case study. This time we're going to dive into some of the sclera as well. This is a woman in her mid-40s. She'd had a diagnosis of polycystic ovarian syndrome. She had 2 children that were ages 8 and 10, 5 feet 10 inches tall, and weighs 275 pounds. She's not happy with that, but she seems to be unable to lose the weight. She's also noticed that she is more rapidly starting to grow hair where it doesn't belong on a woman. So she's got more facial hair, things like that. She has fatigue, depression, and she's on a prescription for antidepressants. Her menstrual cycles are not regular, and they bounce around anywhere from 4 to 6 weeks. She was born without an ileocecal valve. She also has rosacea. She's worked with a nutritionist before, but she was given a one-size-fits-all program, and she didn't like that. She felt like she was unique and she should have some unique considerations. So when we focus only on markers that give us information about what she wants help with, It will help us to trace things back to the roots of her symptoms. So remember, she wants help with weight loss, and she understands that her weight issues are related to the insulin resistance that are a part of polycystic ovarian syndrome. So she has a biliary constitution, which means that her liver wants to run the show. She is anxiety tetanic, which means she burns through her B vitamins, vitamin C, calcium, and magnesium. She has additional brown pigments in her eyes, which suggests that she is at an increased risk for the MTHFR, which means we're not going to use regular B vitamins with her for the anxiety tetanic. We need to use a methylated B with her. In her left iris, we see that at about 25 minutes in the ovary, we've got a little dark patch. And in her right iris in zone 3 at about 34 minutes, again, we've got something in the ovary. This does not mean she has PCOS. It means there's a predisposition to some kind of anomaly with the ovaries. That's all it means. So we cannot diagnose a disease here. She's got the symptoms, she's had the medical diagnosis, we see the eyes give us understanding. In her sclerae, we see this, which is called a fungal labyrinth, and we see little patches where it's a bit yellow, an uneven yellow. This suggests that she might be carrying a fungus. We see slight indications of fermentation signs, which says she might be fermenting things. And we've got that bit of yellow, which would suggest maybe some liver questions. So that's all I needed to see. We got her onto a methylated B complex, and we also used an acetylcysteine. We got her, and that is to help the liver with its phase 1, phase 2 detox. We got her off her big box brand gummy melatonin and her gummy vitamin D and her gummy multivitamin and her gummy vitamin C. They were so low dose and so full of things that we shouldn't be eating. Her food intake was sporadic and sloppy. So we were really starting from scratch to establish good nutrition, and we had to start small. She was not hungry at breakfast, so I didn't want to push for breakfast just yet. Her lunch was soup or a salad or a sandwich on white bread. And so I suggested that maybe a homemade broth-based soup with a good amount of protein and vegetables in it would be a good thing. Supper was protein and vegetables. She used to have a lot of rice with this, so I asked her if she could drop the rice and just add more of the low-carb vegetables. That was an easy swap out. And we did work on increasing her water to 2 liters or 8 glasses a day. So what have we done there again? We swapped out her lunch for something that she could make in a big batch and freeze in individual servings so that making lunch is not a hassle. We swapped out the carbohydrate, the heavy carb in her supper for a lower carb in her vegetables. That's all. And we got her to drink more water. And then I suggested that she start walking for 5 minutes after each meal, and every week increase it by 2 minutes at a time until she was actually walking for 15 to 20 minutes. At 4 weeks, this is what she reported. Now, that wasn't a lot of change, right? But it was significant change. She loves the low carb. She found that her digestion felt better. Her energy was improved. Her body shape was changing. Her clothes weren't much looser. She had only lost 4 pounds, but she had an extra several inches in her pants. Fantastic. She stopped the antidepressant on her own. She said she felt happier. Her husband said she's sleeping more peacefully, and she wakes up with more energy. In that second appointment, we added collagen to her program. 4 weeks later, she came back in. She was down another 4 pounds, and she had never gone down consistently over an 8-week period previously. She was down 2 full pant sizes. That's huge. Her doctor then said, she had some labs, and her doctor said that her labs, her blood was coming out better than it had ever done before, And whatever she was doing, just keep doing it. So in that appointment, then we added some super omega-3 to her program. So we kept using the same set of eye photos for the full course of a year. And we just constantly kept adjusting her program ever so slightly, because the iridology helped us with, we understood what she wanted help with, but the eyes helped us to understand how to help her. We asked her enough questions to know where she was starting from so that we could use the eyes to guide how we needed to move her along the pathway. The eyes helped us to understand how the organs worked together. And again, having that A and P is so important. So important. It allows us to go so much deeper. So with the exception of the anatomy and physiology, all the kinds of things you've seen right there are the kinds of things that I include in the Dynamic Iridology Assessment System program. And it is now open for registration for the November 1st start date. So if you have anatomy and physiology and you want to add iridology at this clinical level to your skill set, use that link that you see on the screen right there, tinyurl.com. Actually, I can pop that in the chat box, and you can go ahead and schedule a time to chat with me. And let's see if this is a good fit for you. I love what Chana is saying here. Woohoo, so excited. Again, she is starting on November 1st. So excited to have her. And Peggy is a graduate of the course. We've had other people on the call today, and they have, some of them are graduates and some of them are not, and some of them are new to me. So thank you so much for being with me today. Absolutely loved having you with me. Thank you for all the interaction in the chat box. That makes my day when my attendees interact with me. And I hope to hear from you on a call, and I look forward to speaking with you again really soon. Bye for now and have a great day.